My practice as a coach focuses on coming alongside physicians who are busy and practicing in complex, challenging healthcare systems. And what I do is I facilitate conversations with them that enable them to clarify for themselves and define their personal and professional goals. Then I work with them to help them develop action plans aligned with their values and beliefs that will allow them to achieve their goals in the most effective and efficient way possible. I'm a board-certified internist and geriatrician. I went to medical school at West Virginia University and completed a residency there in internal medicine. Subsequently, I pursued a medical research fellowship at Johns Hopkins University. I then took a faculty position at the University of Alabama at Birmingham, where I served as the founding director for the Division of Gerontology, Geriatrics, and Palliative Care, and also as the founding director of a geriatric research, education, and clinical center at the Birmingham VA Medical Center. In 2014, I decided to move to the Washington, D.C. metro area to assume leadership for the office responsible for policy and planning for geriatrics, palliative care, and long-term care within the Department of Veterans Affairs. After serving in that role for 4 years, I decided it was time to start serving my colleagues and using the knowledge and skills and abilities that I'd acquired over 30 years in leadership positions to help support them in achieving their professional goals. So the busiest physicians are likely the ones to face some of the hardest challenges and the most likely to benefit from a professional coach. The evidence suggests from a randomized controlled trial among practicing physicians that 6 months of professional coaching can reduce the symptoms of burnout, including emotional exhaustion among practicing physicians. Moreover, it not only reduces those symptoms of burnout, but enhances the physician's sense of life satisfaction and also their sense of resilience, that is, their ability to deal with stress and change. So those busy physicians out there are the ones who are most likely to benefit from working with a coach. The ever-increasing and changing environment that we're called upon to practice in. Electronic health records, administrative burden, all the different challenges that we're facing. Those are the biggest challenge for practicing medicine today. I started counting calories, keeping a food diary, and increasing physical activity in order to achieve a more healthy weight back a couple years ago. And over about 12 months, I was able to lose nearly 60 pounds. After that, I decided, well, I need to integrate strength training into my physical activity regimen to kind of get back to where I was or had been in terms of strength. I pray daily, I read the Bible daily, I participate regularly in fellowship and service with other people. And all of these things bring meaning and purpose to my life. I also find it very meaningful to support and help and come alongside younger people in particular who desire mentoring. So all of these activities support my sense of purpose and meaning and well-being. Take time for yourself to identify the things that really matter to you. What brings you the greatest sense of meaning and purpose? And then take a look at your calendar and schedule your time so that it addresses your personal priorities.